Right, thanks, Ashley. Well, prostate cancer is the second leading cause of cancer death in American men, behind only lung cancer. But did you know that there is a known link to family history? Here to talk about that is Susan Capasso, a genetic counselor at St. Vincent's Medical Center. Welcome, Susan.
Welcome. Good afternoon.
So tell us, what is the link between prostate cancer and genetics?
Well, prostate cancer has long been recognized to have a familial component. In fact, of all human cancers, prostate cancer is the most common among family members, with 57% of prostate cancer attributable to genes that run in families. Knowing your family history is extremely important, and everyone should sit down together and make sure that they do this. And in fact, Thanksgiving is considered to be the National Family History Day.
All right, what are the genetic risks for prostate cancer?
Well, if we look at the genetic risk, we see age. The risks, I should say. Age is the risk of prostate cancer increases with age, with the average age diagnosis of 69. However, it can occur at a much younger time also. Also, let's look at race. Black men are over 75% more likely to develop prostate cancer. And the Prostate Cancer Foundation showed that men of West African descent might have an increased risk for an aggressive prostate cancer, which is based on the inheritance of multiple genes. We also need to look at the genetics. We have familial and we also have hereditary. If we look at familial, it's not a single gene. It's caused by the environment along with genes. And people with familial cancer may have one or more relatives who have prostate cancer. However, there does not appear to be a specific pattern for the inheritance. A man with a father or brother who's had prostate cancer may have twofold increased risk for developing prostate cancer himself. And if you are, and hereditary is where you get it from your parents.
Okay, you're a genetic counselor, so tell us what's involved in genetic testing and what can testing tell people?
Well, if you go to speak to a genetic counselor will go through your risks, and they will talk to you, and they'll take a family history. And then they will also start up the genetic testing. And today, the main genetic testing which is done with a panel test, where we're testing for multiple genes. It takes about 3 to 4 weeks. And when you get this back, you see that you have one of these genes that are associated with prostate cancer, such as BRCA1 or BRCA2. And then we can go further and start to look at other family members and see if they have the disease too.
Okay, tell us about your upcoming webinar quickly.
So on Tuesday, July 13th at 6:30, I'm going to discuss risk factors, the importance of a family history, how to take a family history, and also the genetic testing.
All right.
And it'll be very interactive.
Excellent. Hartford Healthcare, Susan Capasso, genetic counselor at St. Vincent's Medical Center. Thanks for being with us.
Okay, have a good day.
You too.